Hello to all. First and foremost, I would like to apologize for not being able to personally attend the conference because of certain unavoidable circumstances. And I extend my sincere gratitude for selecting our paper for this conference. My name is Anu Maria Joykutti, and I am going to present our paper titled Automated Surveillance System for Infection Control. It is co authored by Ms. Benzie Wilson. First, I would like to give you a quick outline of the presentation. First, we'll have a brief introduction about infection control and also what is the need or importance of having an automated system for infection control. Then we'll discuss about the proposed solution for the same, followed by the system architecture and also the process flow. The prototype is developed based on the proposal, and there are a few figures that describes the same, and then we have the conclusion. Now, what is infection control? Most of the healthcare facilities are having strict policies for controlling the transmission of harmful microorganisms within its premise that include education and awareness, immunization, standard hygiene practices, etc. Even after enforcing such stringent policies and guidelines, the spread of healthcare associated infections are common. 7% of hospitalized patients in developed and 10% of in developing countries acquire at least one healthcare associated infection when they are being hospitalized. The leading causes of deaths in the US, the fourth leading cause of death in Canada, and the cost of industry and it costs the industry billions of dollars a year. So, as we can see that infection control or infections associated with hospitals are a major cause of worry for the healthcare sector. Hence, it is essential to have infections timely identified, monitored, and then contained so that it can be prevented effectively. What happens if such transmissions are not timely identified or monitored? Then it can lead to a widespread outbreak within the facility, further resulting in the deterioration of the healthcare standards. But most of the conventional methods used for such surveillance are time consuming and labor expensive. Here arises the need for having an automated surveillance system. Why it is required is that sometimes infection control tends to be overlooked, and hence we require an effective system that will monitor and contain the infection spread within the healthcare system. Now, we can discuss in detail about the importance of having an automated infection control system. The seminal study of the efficacy of nosocomial infection control demonstrated that up to 10 to 70% of HIAs could be prevented by systematic surveillance and implementation of standard preventive guidelines. An automated surveillance system will help in yielding better results by providing timely and accurate results, which will ensure that the adequate precautionary measures are taken as and when indicated by the system. But despite evidence that automated systems may improve efficiency of data collection and potentially improve patient outcomes, automated surveillance systems remain relatively uncommon in infection prevention and control programs. Now, we'll discuss about the proposed solution. Instead of using manual techniques that will monitor the infection level within a healthcare system, we are proposing an automated surveillance systems. This will highly improve the efficiency and accuracy of the surveillance technique. The system that we have proposed, it takes the input from the hospital information system and the laboratory information system. Now, the laboratory information system is a subsystem of the hospital information system which will majorly contain the laboratory information data. There will be a predefined set of scenarios that can be considered as a potential outbreak, but this can be configured. For example, if a particular microorganism is being seen more than a certain more than a certain threshold level within a few days in the hospital, then it can be classified as a potential threat kind of scenario. When such a scenario is identified by the system, it generates an alert to the infection control practitioner so that the necessary control measures can be implemented. This system can be clubbed along with the hospital information system, which avoids the need for further keying in of data. It will take its inputs from the already existing data, and then it identifies the situations which can be classified as a potential outbreak, and then it will alert the concerned department. Now, this is the proposed system architecture. As I already said, the automated surveillance system gets its input data from the hospital information system as well as from the laboratory information system. So these two are the parts of the data sources that we have. The key input for the system is the laboratory data of every incident being reported in the hospital, thereby using and analyzing real-time information to give the alerts at the earliest to control any infection being identified. The laboratory information system will send test results of the tests that are done on the patients to aid the diagnosis and also to be maintained as part of the medical history of the patient. Also, the hospital information system will have the necessary patient information, related information, including the diagnosis and history, the past outbreaks that has been identified by the same system, etc. Also, there is a we also give the information back to the hospital information system to be stored there so that they can use this historical data for future analysis. Now we have the core system that is used for analyzing the data and identifying the alerts. There is the configuration table which will have the entire set of criteria that has been developed on the basis of which the scenarios are to be classified as an alert or not an alertable situation. The surveillance systems depends on this one table to classify the incidents to various categories of outbreak, which shall be considered to identify repeating occurrence of the patterns. The data processing module we have of the ASSI system receives the incident data from the input sources, that is from the LIS and the HIS, and it processes the data. The data processing engine that we have over here, it works as a first line filter, classifying the incidents into different patterns based on the rules. There is a surveillance engine which will decide if the incident being analyzed are to be classified as an infection outbreak or not. Each incident being classified and passed onto a surveillance engine is correlated with the rules and the surveillance history of the incidents. If the particular incident crosses the threshold number of incidents, it is declared as an infectious outbreak. Then the necessary directions will be given to the alert system. For example, a rule will have said where a particular microorganism is being analyzed, then if it crosses the allowable threshold or the count, that is the number of affected cases, the number of days to be considered, all these things are considered, and if the data satisfies any of these rules criteria, it is being added to the surveillance table. Now we have the surveillance database, the role of which is to store every incident in their respective classified conditions to be invoked by the surveillance engine to check the number of occurrences. Then we have the history table, which will store every potential outbreak that has been identified by the system. It serves as a repository of the past outbreaks, which can be used retrospectively to identify new patterns or parameters associated with such outbreaks. Then finally we have the alert mechanism, which is being triggered by the trigger engine, which will have various modes. It can be either through an email or through an SMS, or we can adopt different mechanisms for alerting the concerned departments. The communications channels can be configured. A notification to the infection control practitioner is sent once the alert is triggered. Based on these alerts, the ICP or the infection control practitioner will be taking the appropriate measures. notifying the concerned department, taking steps for containing the infection, or improving the hygiene standards, and constantly monitoring the situation, etc. So this figure shows the process flow that we have within the systems. First, the incidents are received, and then the data processor engine, it will classify it, and then the rules database that we have is what provides the rules for the classification for the data processor. The rules are again based on the configuration table, the configuration that we have set on the configuration table. And once the initial classification is being done by the data processor, the surveillance engine receives that particular incident, and it will classify and it will analyze it whether it is a potential outbreak or not. If it has been identified as an infection, as an outbreak, then it will be sent to the trigger engine for the alerts. The trigger engine will trigger the alert, and then it will send the alert to the concerned department. If it has and also if it has been identified as an infection, it will be given to the history table for storing it for future reference. Now, as you can see, this is a prototype of the system that we have developed. What we can see here is the admin screen, where the system admin can do the necessary configuration setup, like setting up the parameters, the count for which the alert needs to be triggered, and how the alert has to be sent, etc., etc. This actually we have developed as a standalone system, but in the actual scenario it has to be plugged in to the hospital information system so that we can avoid the necessity of keying in extra data for this purpose. Now this is the alerts table, where the alerts are being stored. As and when an alert is being generated, the alerts will be stored within this table so that it can be used for future purpose also. And then this is one of the methods of sending the alerts to the infection control practitioner as an email. So as and when an alert is being triggered, an email is being sent to the infection control practitioner, and then he can do the necessary measures, that whatever is required for containing that particular infection scenario. So as we have discussed, this paper proposes a system for automated surveillance systems in healthcare organizations. We can readily use the data that is already available within the healthcare facility, and it can be utilized effectively for extracting useful information, which can be used for many purposes. And one such example is having an automated surveillance system. As we know, the system already collects the available data from the existing system, and hence it avoids the requirement for having an additional keying in of data. And also it identifies any potential outbreaks, infectious outbreaks, and alert the organization early enough to handle and bring the infection under control. The system makes the identification and control much faster compared to manual mode of monitoring, and it helps avoiding potential risk. The system and data may provide a great deal of further information for further medical research and all. And I truly believe that this kind of a system will definitely help in containing the infections to a greater extent, and hence it will help in saving more lives. Thank you.